Gang, today I'm sitting down with someone who has seen the inside of the Medicare system in a way that almost nobody has. We're sitting down with Kobe Blumenfeld Gantz. He's the CEO of Chapter, our trusted Medicare partner, and he's someone who spoke to the Senate. He actually testified to the Senate about deceptive Medicare practices. But what's really interesting here is that why he founded Chapter, how he founded Chapter. And it is because one of the big reasons is because of his parents. And we're going to talk about that in just a moment. Now, if you are approaching 65, or if you are on Medicare now, or you know someone who is 65 or who is on Medicare, this is a really important interview. And it can save someone you love or you yourself hundreds, if not thousands of dollars a year. Having said all of that, let me welcome Kobe to the channel. And why don't we jump right into it? Welcome, Kobe.
Thanks so much for having me. It's great to be here.
Now, I want to hear, I think we all want to hear about the story about your parents. Can you tell us what happened?
A few years ago, I was helping my parents enroll in Medicare. I was kind of observing them first as they navigated the process. And they ended up having to go to the Social Security office multiple times, sending a bunch of faxes. They were working with a local broker. And at the time, everything seemed fine. I have no background in Medicare before starting Chapter. So at the time, I didn't know much. And I quickly realized that the plan that they had enrolled in from this Medicare broker was far more expensive than it needed to be for the same coverage. And at the same time, we didn't realize that my mom had been subject to lifetime late enrollment Part D penalties because she had received bad guidance. And so as I looked into just how the industry operates more and more, it became more and more crazy to me that the default is that people have to go through so many steps to not only sign up for original Medicare, but then all the supplemental components and navigate the thousands of options that are available to them. So as I was helping my parents, this just became like so obvious to me that this is not how we are supposed to be supporting our elders in with their health and financial choices in this phase of life. And I wanted to start a company that tries to change that.
Okay. And so before Chapter, you were at Palantir and you were in the software business. So this was a big jump for you from, well, at least not the tech part, but from one industry to another.
It was. I had spent almost 7 years at Palantir, mostly focused on U.S. government work, building different types of data systems for the government. Um, I worked a little bit with the federal health system, but not as much. And when I started the company, I didn't really anticipate having to deal with the government. It was meant to be a very different industry focused on just helping consumers, helping Americans navigate this process. Now, of course, it's come full circle, and I end up spending a fair amount of my time working in some ways directly, in some ways indirectly with the government. So yes, it was a big transition. But the common thread really has been the concept of how do you make data that's very complicated and very siloed very useful. And in
Yeah.
Medicare, one of the core challenges that exists is there's a lot of data that's messy, that's unstructured, and that's siloed. And so I took a lot of the lessons from working at Palantir and from working with amazing engineers to build a platform that makes it really easy to understand these complexities.
And so the moment you saw your parents going through this, combined with your background, you saw an opportunity, I guess, number one, to make a difference and make things better, but really build a system or a product that a lot of people could really use and need.
Yeah, I started by just looking to see if there were good options that I could send my parents to, and there just weren't. I spent a lot of time going through different companies' websites, products, working with a lot of different brokers to understand what exists, what options exist. I was not particularly trying to start a company, so it wasn't the sort of problem space attracted me more than the idea of starting a business. And so I was really just trying to understand how the market works, and it doesn't work is the reality.
Yeah. Yeah. Well, you testified before the Senate about deceptive practices in the industry?
There's so many different aspects of this. We can talk for a while about this. Maybe the two most prevalent are, the first is when we talk about an independent Medicare advisor or Medicare broker, most people think that that person is independent. That's actually not what it means, which is one of the reasons why this is so misleading. Independent Medicare broker just means you work with at least two Medicare companies. Doesn't mean
Too.
you're independent. It just means you work with at least two, not one.
That's
So
okay.
yeah, it was a shock to me too. And so really the way most of the industry works is you have Medicare brokers who represent a small subset of insurance carriers. It might be a couple plans, it might be a few plans, but there are hundreds of options available to each person. And that's not known by most people because it's a pretty niche area of expertise. So one of the points of deception, which isn't explicit but it's implicit, is that legally and technically, Medicare brokers are agents of the insurance carrier. They're not agents of the consumer. There is no concept of a fiduciary standard in Medicare. And so
Oh,
that's one of the
that's
things that I have been advocating for. That's one of the things I was talking to the Senate about, creating this fiduciary standard so that the consumer is always the person that you're looking after.
and so there could be a situation where a broker has two plans that have the identical coverage, and they could recommend the more expensive plan. Does that
Yes.
happen? Right.
In fact, that's probably the stat. That's probably normal. That's probably what happens in most cases.
Is it because they just don't have access to all the information, or is it because they know that this one's going to pay them more than that one, and so therefore this one is the one that they recommend?
I think there are two categories. There are organizations that just aren't sophisticated. So, a local Medicare advisor doesn't have an engineering team, doesn't have sophisticated data assets, doesn't have sort of the infrastructure to really understand the complexities here. And so, for them, in most cases, I don't think it's malicious. I think it's just sort of lack of tooling and lack of data access, as you alluded to. There are other companies that I actually do think are malicious and are just trying to sell. They really think about it as selling plans, selling products that pay them the most. So I think there are two categories of that. The end result to the consumer is kind of the same. You're getting the wrong Medicare plan, and you're not getting a good service. But the motivations, I think, are slightly different.
In a previous interview, we did a bit of research before you came on the channel here. You talked about the fact that there's significant fraud. I think the number was $100 billion of annual Medicare fraud. Can you touch on that a little bit? Just the nature of it, what it is, and how it affects the end consumer?
There's a tremendous amount of fraud in Medicare. That $100 billion is actually just a subset of it. That is simply the uh, sort of deadweight loss to society because of bad plan recommendations, because people enroll in the wrong Medicare plan. That's just the amount of money that consumers would save per year if they were on the right Medicare plan. Um, if you expand that concentric circle to what are the implications of being on the wrong Medicare plan, it's additional costs to the entire ecosystem, to the entire health system, then
Yeah.
it's much larger than $100 billion. And that doesn't include the true malicious fraud of how there are a lot of companies and a lot of individuals that are trying to defraud the government and just the system by incorrect billing, upcoding, all these things that we've probably heard a lot about. But that $100 billion is just the amount that consumers should be capturing each year in savings that they are not, because they're not on the right Medicare plan, which is an inordinate amount of money.
That is a lot of money, no matter how you look at it, whether you're talking about a company, the government, or certainly a large group of individuals. There's no way to say that that isn't a lot of money.
Yeah.
Now, one of the one of the stats I read out there is that there are 24,000 plan combinations. Is that would make it really hard, I would think, to pick the right plan on your own if you're just going to Medicare.gov and trying to figure it out. Am I wrong in assuming that, or is that
No, it's spot
pretty
on. Most people don't realize there are about 24,000 options nationwide. each individual person has hundreds of options available to them
Oh,
to choose from, and they all operate differently. There's Medicare Advantage, there's Medicare Supplement, there's Part D, and these interact in different ways. And it's very challenging to know A, which path you should go down, and B, with which specific plan or product you should buy within that path. And for something like Medicare.gov, it doesn't even have all the plan options on the website, which is one issue. It also has a lot of incorrect data. And it's the government. They're not going to be the best at walking you through how to do it. They're just not set up to do that. I heard a podcast a couple of years ago from a health economist professor at Stanford. It's a guy who has a PhD in health economics. And the podcast was just about the state of the health system. It wasn't about Medicare at all. And he just made a side comment about how he has a PhD in health economics and he has no idea how to sign up for Medicare. He was approaching 65. And if this guy who's a health economist at one of the world's best academic institutions can't figure it out, how is anyone supposed to?
now there's a concept, and it really feeds into what you're talking about, called one-way doors, and that is you make a choice, and you can't turn around once you close that door and undo it. Can you talk about the one-way doors in Medicare in particular? Because I think that this is something people really need to hear about.
There are a few really important one-way doors that people don't realize. One is when you initially sign up for Medicare, so when you're signing up for the first time, you have a lot more optionality about what types of plans you can enroll in. And then when you're trying to switch plans or optimize coverage over time, in most cases you don't have that same optionality. So specifically, when you are signing up for a Medicare supplement plan, if that's what you try to sign up for, when you initially sign up, a health insurance carrier cannot deny you. They cannot look at your health history. They cannot change your rate due to your health history. But if you sign up for a Medicare Advantage plan when you first sign up for Medicare, and then let's say 2 or 3 years later, you want to switch to a Medicare supplement plan, unless you're in a small subset of states or you have a couple specific exceptions, you are subject to health underwriting. And so an insurance carrier will look at your health history and they can either charge you more, depending on the state, or they can actually deny you entry into that plan. So signing up for Medicare Advantage when you first sign up for Medicare is in many ways a one-way door for most people, in that you cannot switch then to Medicare supplement without undergoing health underwriting.
Does that
So that's
happen where,
that.
sorry,
Go
Kobe,
ahead.
didn't mean to cut you off. Does that happen a lot? Do you see that happen a lot where somebody signs up for a Medicare Advantage plan and then all of a sudden their health condition changes and they think, I need better coverage. I better switch to a
We
Medigap
see it
plan. And
every day.
really,
Every day. It's very common. And it's common for a couple of reasons. One is one of the reasons people choose Medicare Advantage plans so predominantly, of course, it has $0 premiums, so it tends to be a trend, has these benefits, so it tends to be attractive to a lot of people. But the other is that Medicare brokers get paid a lot more to sell Medicare Advantage plans. And so you have all these advertisements and all these Medicare brokers pushing MA plans. If you go to most Medicare brokers in the country, 99.9% of what they sell is Medicare Advantage. Even if they have Medicare Supplement or they can sell Medicare Supplement, if you look at what they actually sell, it's Medicare Advantage in most cases, not every case, but most cases. So a lot of people don't even know that Medicare Supplement exists as an option. Or if they do know it exists, they don't understand the trade-offs. So we often see people say, yeah, I signed up for a Medicare Advantage plan because that's what my broker said or my advisor said, or that's what my neighbor has. But I'm realizing that I should be on a supplement. Yes, that is probably true. You should be on a supplement, but it can be hard to make that change if you're not healthy.
so let's say that somebody is on a Medigap plan for whatever reason, and they want to switch to a Medicare Advantage plan. What should they think about before they do that? What should they think about first?
Frankly, it's really just a personal choice, and we try not to make generalities because it really is all things like all healthcare and all financial decisions are pretty personal. But broadly, again, if you switch into a Medicare Advantage plan, then you can't go back to a Medigap plan without going through underwriting again, unless you're in one of a few states. So that's one thing to think about. Another is that you will be heavily constrained by the provider network. So Medicare Advantage plans are by nature network-based plans, so they limit the specific. They have a network of doctors you're allowed to see. Medicare Supplement or Medigap plans operate on the original Medicare network, which is 93 or 94% of doctors in the country. And so there are all these constraints that are imposed on you if you sign up for a Medicare Advantage plan. Um, and again, it's very hard. It can be very hard to switch back to a Medicare Supplement plan.
As I think about it, because we know a lot about Medigap and Medicare Advantage plans, uh, a lot of it comes through the excellent work of your company and the team you have there, and educating us over the years. But why would somebody do that? Is there any good reason to move from a Medigap plan to a Medicare Advantage plan?
There are a couple of reasons people do it. Often, the most common reason it happens is because people get sold. People get convinced by someone who's trying to make a buck. Um, and if you're not particularly well informed on the topic, it can seem attractive. The premiums can go, a Medigap premium, depending on where you live and the type of plan you have, can be anywhere from 200 to 350 bucks a month, which is material. Um, that can go down to zero. So, hey, let's save you $3,000 by switching you to an MA plan. That can sound great, again, to the uninformed listener. So that's one. Um, Another is that if you have a large benefit that you need. So, for example, maybe you're prescribed hearing aids for the first time. Hearing aids can be very expensive, $4, $5, $6,000 or more if you get a premium hearing aid. And many Medicare Advantage plans heavily subsidize the hearing aid. So again, it can seem like an attractive financial decision to go onto a Medicare Advantage plan that has a lot of subsidies here. But again, the ultimate trade-off is that you then don't have access to the robust health coverage that a Medigap plan offers. And so, look, there's some people whose economics or financial situation may materially change. Again, Medicare supplement plans are not cheap. If you really can't afford 300 bucks a month in premiums because you can't afford to live with paying that, then yeah, you should go on a Medicare Advantage plan. We unfortunately not everyone has the option, so maybe that would be a situation where you don't have much of a choice. But broadly, we wouldn't recommend it.
Yeah. Maybe we can just switch to talk about Part D, Medicare Part D, and there's been a lot of press about Medicare Part D lately, and one of the things is the change in the plans. They change annually. Some of them change annually. I suppose the question is, how many people actually review their change annually when they get the annual notice? How many people actually read that and and act upon it? And how many people are surprised when their expensive medications are no longer covered?
It's pretty common for people to be surprised. Yes, Part D plans operate similar to Medicare Advantage plans in that you can switch them every year, they can change every year, and you have most flexibility to change them in Q4 in the annual enrollment period, which is October 15th to December 7th. Um, the most recent statistics I saw in this were from Kaiser Family Foundation that did a study a couple years ago, which found that about 30% of people review their plans every year, or their Medicare Advantage and Part D plans every year, and about 15%, so half of those, end up actually switching. So a pretty small number in aggregate actually switch plans.
Mm.
We think people should be reviewing their coverage every year and potentially switching their plan, much more common, especially on Part D, because unlike unlike other types of Medicare, Part D really is a math problem. And what I mean by that is it's it's really a function of what prescriptions are you taking and how do you minimize that cost. There, you don't really care what. It's not a function of what doctor prescribes it. So it doesn't have the same type of implications as Medicare Advantage or Medigap because it really is just how do I minimize my prescriptions that I take and that I'm going to need to take. We've built some really cool technology and data assets around that to automate it and know with a lot more fidelity how to save money. But it is really about making sure that your drugs are covered and at the lowest possible tier.
Thank you. Now, on our Tuesday live streams, we get this question comes up all of the time, and it's one. It's very frustrating for me because I already know the answer, but but it's so common. I'm just going to ask you to talk about it. And that is the Part B late enrollment penalty. And this seems to catch a lot of people off guard. They think that they're fine because you know what? The government doesn't have to pay for my health insurance for an extra year or two, so I'm just gonna kind of ignore it until I feel like I need to deal with this. It's a pretty common point that's made on our live stream. Is this something that you see a lot at Chapter?
We do. And I think the data suggests that a few million people are subject to late enrollment penalties every year. So it's not a small number of people who miss this. And if it helps, I can share the policy rationale because it does make sense why the government does it, but that doesn't make it any less frustrating that this happens to people. So the policy rationale is like any health insurance risk pool, they need to make sure that people are opting into the risk pool when they are younger and healthier. And so for Medicare, that's right when you turn 65 or retire. And so if they were to say you can enroll in Medicare at any point, it would destroy the risk pool because people would only enroll once they're sick. And it would make the economics not work. So that's the policy rationale why they have a penalty if you don't sign up immediately. The very frustrating thing is they don't make it easy to sign up, and the education on this is not particularly clear that you have to sign up if you fall into one of certain conditions. If you're still employed, that's usually considered creditable coverage, but not always. If your employer is fewer than 20 people, you actually have to go on to Medicare or you will be hit with late enrollment penalties. And there are all these weird esoteric rules that people don't realize. And that's why it can be very, very frustrating.
Like Cobra. That one still I
Co-
don't fully understand. So
yep.
perhaps you can tell the group what I'm talking about because I think that would be an esoteric rule that a lot of people would think I'm on the company plan. What's the problem?
Yes, COBRA is not considered creditable coverage after a certain number of months. So let's say you're 66 and you retire and you want to stay on COBRA because you like your company's health insurance, um, and maybe they're giving you a subsidy to stay on COBRA. Um, that's great, but COBRA, you have to have creditable coverage the way the government defines it, and COBRA, for policy reasons, is not considered creditable coverage. So you are then required to sign up for Medicare Part B within a certain number of months, or you will have those enrollment penalties.
Let's look at the demographics of this channel. A lot of people are on either side of 65. That's just the viewer base. You have a lot of people who are making this decision soon. And what's the most expensive mistake that you see for people who are turning 65 when it comes to Medicare?
One of the most expensive mistakes is choosing a Medicare Advantage plan. Again, if it's the only thing you can afford, you don't have as much of a choice, and that's just the reality. But because it is this one-way door, over the course of 10 or 20 years, it can become very expensive. One very concrete example is if you are forced to stay in the hospital overnight for multiple days, most Medicare Advantage plans have relatively low limits about the amount of hospital coverage they will provide. And so that is one very simple way where people tend to rack up very high bills on a Medicare Advantage plan that people don't realize.
Mm,
Another very common mistake is not looking around at all the options of Medigap plan. So if you are buying a Medigap plan, every Medigap Plan G is identical. Every Medigap Plan N is identical. By law, Plan G is a Plan G. Plan N is a Plan N. Doesn't matter if it comes from United or Aetna or Anthem or Humana. It doesn't matter. They're all the same. And so really what you should be optimizing for is price of the plan today, so premium of the plan today, and expected future increase of that premium over time. And we see all the time that people just say, oh, I'm going to buy, the insert insurance carrier Plan G because I've been on that same carrier on my commercial health insurance with my employer for the past 20 years and I like them. That's fine, but it's not actually relevant. And so you might be paying $200, $300 a month more than you need to for identical coverage.
right.
And I think that's another thing that people really don't realize.
And then 5 years later, when their door has shut behind them or their options are limited, particularly on a Medicare Advantage plan, they're they find themselves in a untenable position.
Yeah, and so what we do, and it's hard to predict with certainty, but we have some algorithms that try to predict what the price increase of a plan might be. So in some cases, we might recommend someone enroll in a plan that's very slightly more expensive today. Maybe it's $2 or $3 a month or $5 a month more expensive today, because we have high confidence that over the next 5 years, you will actually be saving thousands of dollars relative to the alternative. Because one of the strategies that a lot of Medicare supplement plans use is they'll arbitrarily lower prices for a year to get people to sign up for them. And then again, it's hard to switch Medicare supplement plans because you have to undergo health underwriting. And then they'll jack up the prices a lot in year 2, 3, or 4. And so we try to
Yeah.
look at, we call it a 10-year sum of premiums, to understand what will your total aggregate spend be over the next 10 years, and try to minimize that number. And again, it's not perfect. It's a high confidence guess. It's not certain, but it is much more certain than anything else.
Well, I think given your background and the technological background of the company, if you can get directionally correct, you're going to be better off as a customer than if you're just not really doing any analytics around it whatsoever.
Exactly. Another really this might be interesting to your audience to hear. Another really interesting piece of technology we built a few months ago, which has saved people a lot of headache, is automating the underwriting process. So if you do have to go through health underwriting, if you want to switch from MA to a Medigap, or from Medigap A to Medigap B, I shouldn't use letters, from Medigap Plan 1 to Medigap Plan 2, it can be very frustrating because you have to fill out the paperwork for every insurance carrier one at a time. You don't know if you're going to pass. It's a lot of headache and it's a lot of anxiety, especially when there are
Yeah.
these monthly deadlines. So we've built an AI that knows, given your prescriptions, given your health history, which insurance carriers are going to accept you and which are not. So you don't even have to go through the process of applying or not applying, because it's frankly just a lot of work and a lot of anxiety. And so with this technology, we're able to say, of the 30 plans that offer a Plan G in your area, these 2 are going to accept you. Let's look at those 2.
That's where having the technology behind the process makes all the difference in the world. You don't have to have customers coming back time and again, reapplying to try to get into a different plan. You have your probability of success model already built out, and you put them right in the right spot.
Yep, exactly.
Now, the next thing we're going to talk about is IRMAA, and this is one that again, on the Tuesday live stream, this is another one of the most common discussions. People are so frustrated with IRMAA, and in particular, the IRMAA surcharge surprise. And perhaps you can talk to the group about how that happens, when it happens, and how they can get a little bit better educated so that if it's going to happen, they see it coming rather than it just happening to them.
IRMAA stands for Income Related Monthly Adjustment Amount. So it's basically the tax on top of the Medicare premium, Medicare Part B premium that people pay. So Medicare Part B uses a progressive tax scheme, which means if you have more assets or higher income, you pay a higher amount. And there's a sliding scale, there's a table, and you can pay it single or jointly, depending on if you have if you file taxes jointly or as individuals, and that determines the amount. What really gets people confused and can cost people a lot of money unnecessarily is the government uses a 2-year look back period and assesses your income from 2 years ago to assess your IRMAA today. Why they do that is a separate conversation, but especially for people who are signing up for Medicare, their income can change dramatically. Often you sign up for Medicare when you retire, so your income might go from quite high to quite low. And
Yeah.
so people are still paying this progressive tax, assuming they're earning their income if they were still working full time. And for a lot of people, that's not true. So you can actually file what's called an IRMAA appeal, and we help people do this. It's a pretty simple document that you can file, and it will have the government reassess you for current income, not 2 years ago income. And you can save a lot of money. I mean, this is a few $100 a month you can save if you file this at the right time.
one of the big points that are made around this on the channel is Roth conversion. And people don't see that Roth conversion as they think it's a good thing. They think that they're managing their money prudently and they're doing the right thing. But instead of doing it over a 2 or 3 or 4 year period, they do it all at once. Do you see that a lot with? Do your advisors see that a lot when they're talking to the customers?
We do. So a Roth conversion is considered an event that the government will still consider that income when assessing your IRMAA. It is not excluded. And so
Yep.
if you are doing that conversion and you have a one-time significant increase in income or in assets, you are going to have a much higher IRMAA assessed. And so that's the implication. As I said, these are all very personal financial and health decisions. So we definitely encourage each person to talk to their financial advisor and talk to their Medicare advisor to make sure that they're navigating it appropriately. But a lot of people just do this without realizing because it's not top of mind, understandably. So it is something we heavily encourage people to ask about before they do.
Yep. That's a good point.
And
Very
sometimes
good
it can
point.
fully offset the amount of savings or the amount of income you're creating if you increase your IRMAA by that much.
Those surcharges can be huge, especially if you're married filing jointly, because then you double it in many cases. Ugh. How does someone know when they're on the wrong plan? What are the warning signs when they're on one plan and they really should be on another? And I think I'm asking this question because we talked about at the beginning how people figure it out when it's too late. But if there are warning signs along the way, things that they can think about that might be useful where they still have time.
One is just asking yourself if you're satisfied with your Medicare plan. Medicare is actually an amazing program. Many people are very happy with the core health insurance and the core experience. It's all the things around the edges, signing up, navigating, dealing with billing, all of that stuff can be very challenging. But the core healthcare and health insurance can be very good. So I think not accepting a bad experience, I'd say, is one. So if you feel like you are limited by the doctors you can see, if you feel like you are paying far more than you think you're getting value for or can afford to pay, um, if there are health procedures or things you think you need that are going to be prohibitively expensive, all of those are good reasons to at least check if there is a better option. Checking is
Mhm.
free, so you might as well understand what the options are.
Yeah, that's a good point. And gang, by the way, I'm going to put a phone number at the bottom right about here, 440-703-1224. And so if you have questions about anything we've talked about so far or anything we're going to talk about, I want to get this here now before we continue on because some of you may or may not watch the entire interview, but I want to give you access to the chapter team, just give them a call at 440-703-1224. As I said, they're a trusted partner of ours. They're one of only three that we have on the channel, and we've done a lot of due diligence on the company, so I think that you'll be impressed with them. But I'll put the number here, and then I'll remind you at the end. Okay, on the next question, then, what about people who need or who look to help a parent or a spouse? Are there any common mistakes that happen where they're trying to help them, but they don't really understand? What do you see when it comes to that situation?
It can be fairly similar for an individual. If you are a caretaker or a child or a friend, a lot of people just operate on assumptions or what they've heard from their friends. And so I think it's a fairly similar set of challenges that people face, except with the one additional constraint and roadblock that many insurance carriers and health providers won't give you information unless you have a power of attorney if you're helping someone.
Mhm.
So it can be even more frustrating to help someone. Um,
Yeah.
so, but a lot of the same challenges exist of not really understanding the trade-offs between plan types and not having full coverage of plans.
Do you get a lot of DIY people that think that they have to pay to have an advisor help them? Because that comes up a lot on the live
Yes,
stream.
a lot of yeah, a lot of people assume that they have to pay us, or can't believe that we do this for free. So that's always a fun part of the conversation when we say, no, you don't owe us anything. It's great. Um, So yes, a lot of people do assume that they have to pay for a Medicare advisor, or they assume that in some way the plan will be more expensive, but it's actually illegal. The regulatory regime makes it illegal for insurance carriers to offer a different price based on where you buy the product, which is actually a very good policy because it encourages people to go to an independent advisor rather than going spending time going to each individual insurance carrier because the price by law has to be the same.
What advice would you give what should someone do today if they're turning 65 soon?
Most important thing is understanding the deadlines. Most important thing. You don't want to be subject to late enrollment penalties, Part B or Part D. You don't want to have a lapse in your health insurance if you do actually need healthcare. So the most important thing is understanding uh, what is your enrollment period. If you're turning 65, it's going to be 3 months before your 65th birthday and 3 months after, so a 7-month window, including your 65th birthday month. If you are retiring, it's going to be the 8 months, 7 to 8 months following your retirement if you're over 65. And so it it's really important to understand what your dates are. And then there's a lot of reading you can do. There's a lot of sort of self-exploration you can do, which is great. I think ultimately, though, um, I would recommend working with an advisor, hopefully Chapter. If not, there are other good advisors out there. So there's just no reason to try to do it yourself. It's important to understand what you're signing up for, certainly, but there are people like us to make sure that you get in the plan that's best for your needs.
Let's just talk through the process. Someone picks up the phone and they call 440-703-1224. They get you on the phone, and what happens next with them?
They'll be matched with one of our Medicare advisors. They're all licensed full-time employees. They are not commission-based. They have the same compensation, whether you enroll in any type of plan, in any specific carrier, it doesn't matter. Whether Chapter is contracted, doesn't matter. Their compensation doesn't change. They will spend as much time as you need educating you, answering your questions on how Medicare works. If you're already quite knowledgeable, they can just go straight into answering your specific questions. And then once our Medicare advisor gives you a sense of sort of how the process works, where you are in the process, timelines, they will actually use our recommendation engine, given your doctors, your prescriptions, your specific inputs. They'll explain the trade-offs of the specific plans, and then if you're ready to sign up then and there, we automate the full sign-up process, so it's quite easy. You sign a document that we send to you via DocuSign or DocuSign equivalent, and you're done. Now, it depends on where you are in the process. Sometimes you need to sign up for Original Medicare first, but we help you with that. Maybe you want to think about your options. We'll send you sort of the options that we discussed. You can think about it. We can schedule a call for next week or whenever the appropriate time is. We try to let the individual drive that, but we're always available to help people. And we really care about having an amazing user experience and a no pressure situation. The only time we will inform people of any pressure is when there's a government mandated deadline that they might be missing, and we'll heavily encourage them to sign up before that deadline.
Well, and you would be doing the right thing by doing that. Now, one thing I think the group should hear about is the fact that you look at and recommend every plan, even if you're not getting paid for it. Is that a fair statement?
Yes. So a really core part of how I set this business up, and one of the things I wanted to solve when we started the company, is this incentive misalignment. We want to make sure that our individual, not only as a company, but as individual Medicare advisors, they don't feel like they have to choose between doing what's right for you, the consumer, and doing what's right for their paycheck. And so our entire model is we give full plan access to our Medicare advisors. They don't know which plans we get paid on and which we don't. They don't know how much we get paid. They don't know sort of if there are pay differences. Their job is to enroll people in the plan that's best for the person, and their compensation is identical regardless. And so on many, many plans every day, we recommend to people that Chapter earns no money on. The reason we do it is not only a mission-oriented one. There is a selfish reason, which is that I actually think it's just long-term correct business strategy, where people have a good experience, they'll recommend their friends to us. Sometimes their friends will enroll in a plan that does earn us money. Sometimes they won't. It doesn't really matter. It's more about sort of getting access to as many people as we can to support as many people as we can. And over time, I just think that creates a better business.
Yeah. Yeah, absolutely. All right, why don't we switch gears to Medicare changes coming up in 2026 and 2027? Things like drug caps, IRA negotiations, Medicare Advantage changes. What should retirees watch in the next 6, 12, 18 months?
There are a lot of changes happening in the industry right now. Probably the most relevant one to a consumer on Medicare or thinking about getting on Medicare is that insurance carriers go through these cycles where sometimes they care a lot about growth and revenue growth, and sometimes they care a lot about profitability. Right now, we're in a profitability focused cycle, which means that carriers are changing their plans, especially the Medicare Advantage plans, to have less generous benefits, to sometimes have higher premiums, and to make it harder to use those plans or harder to get authorization to get the procedures you might need. There's a lot of talk in the news about prior auth changes. So, because of that underlying economic change and economic cycle that they are feeling, that will be passed down in some ways to the consumer. It already has been over the past year. We saw a lot of plan changes over the past few months. Plans are slightly less generous in a lot of benefits, or the networks are narrower. And I think that will probably continue for the next 12 to 18 months before we move more back into the growth mode where the plans become more generous again.
I read in it was either the Wall Street Journal or the New York Times that the number of people who were signing up for a Medicare Advantage plan was expected to go backwards in 2026. I don't think they had the actual data whether it was actually going to happen or not, but their models had predicted that might be a possibility. Do you know anything about what the outcome was there?
I don't. I think if you include special needs plans, I don't think it actually went backwards. I think it actually went up, but by a smaller percent than in the past. And that's really, I think, a function of the actual benefits and the plans becoming worse and people becoming more knowledgeable about the existence of Medigap plans and the existence of alternatives. I also think a lot of people have had a really bad experience over the past few years with prior auth. So if you do need to get a procedure that requires the insurance carrier to approve it, that experience has just been really frustrating for so many people. And even if you personally haven't had that experience, probably one of your friends has and has told you about it. And I do think that is starting to create a narrative among Medicare beneficiaries that Medicare Advantage isn't necessarily as great as people have always perceived it to be.
Now, one thing you mentioned earlier, and I just want to touch upon this more because I'm curious, and that is AI at Chapter, and and what's going on with the AI component at Chapter. It went from being just globally an acronym that was barely in existence 3 years ago. Now you see some pretty big things happening at companies. What's happening with yours?
Yeah, we don't talk about AI publicly that much, but we are extremely heavily an AI first or AI focused company. We build a lot on top of AI. We use AI heavily throughout the company. So I'm happy to share a little bit more about it. We really consider ourselves a technology company at our core. And so it's heavily ingrained into everything we do. There's a few, I think, pretty exciting ways that we use it. Our whole philosophy is we want to use AI to augment our Medicare advisors and augment the consumer experience. And then we want to use, so that's kind of the augment, not replace. And then we do want to use AI to replace on sort of the back office things that people don't want to deal with. So from we don't want to get rid of the human interaction or the human relationship. We think that's really important. Most people want to talk to a human, and frankly, AI isn't quite good enough to handle those conversations autonomously anyway. But there are a lot of things AI is amazing at. So a couple of examples. One is a notorious problem in healthcare is provider directories. What this means is knowing what doctors are in network with what plan. It's a very simple concept and one that most people think should just be defined somewhere. Yes, there is a relationship, there's a contract between a doctor and an insurance carrier. This should be a known thing. It should be solved. It's kind of a notoriously unsolved problem in healthcare. We have invested a ton of time and engineering hours into making this way better. The current best provider directory in Medicare is about 55% accurate, 55 to 60% accurate. And so what this means is in almost half the cases, if you're looking, especially for Medicare Advantage in particular, if you're looking up, is your doctor in network with my Medicare Advantage plan? In half the cases, you're wrong, which is wild. We have invested a ton of energy into building AI that actually gets that accuracy closer to 95%. So we know with 95% confidence if this doctor is in network, which is a huge improvement and really matters when people are choosing a Medicare Advantage plan in particular. So that's one place we've used it a lot. Another place we've used it a lot is just because we do so much work on the phones when we're talking to our members. It can be really hard to track everything that's going on. So we now have an AI co-pilot that is helping our advisors keep track of everything. If they do make a mistake, it notifies them that they may have said something that's incorrect. If they forget to follow up, we've automated a lot of the follow-ups. We use AI to fill out a lot of the forms so the member doesn't have to. As I mentioned, this underwriting technology, that's AI-based, so we know what plans are going to accept you for underwriting and which aren't, to save a lot of time. A lot of time, Medicare is so complicated. There's so many edge cases based on where you live, what conditions you might have, what weird rule you fall into for one of gazillions of reasons. And even the best Medicare advisors don't know every single rule. Nor, like, they're human, they're going to research it, right? And the best Medicare advisors research and know where to find the right information if it's sort of that long tail of 1% of things. So we've built a lot of AI to surface the correct information very easily for them so that the member doesn't have to sit waiting on the phone for 10 minutes while the advisor researches something. It comes in 10 seconds now. And so it's a lot of these things. It's not one thing, but it's very exciting, and we're heavily investing there.
I'm going to end it with one final question, and it's the curveball question. And that is, if there is one thing you want every person watching this to understand about Medicare that almost nobody talks about, what is it?
I said this already, so I'm cheating a little bit, but it is that every single Medicare advisor in the country, with the exception of Chapter, of course, is an agent of the insurance carrier, not an agent of you. And I think that is not talked about at all. People don't understand this, and it's really important that people understand that they need to get advice that is unbiased, and independent doesn't actually mean independent in Medicare.
Kobe, thank you. Gang, if this interview has opened your eyes as it has mine, give our partner at Chapter a call and see if they can help. 440-703-1224. We have sent a lot of people to them over the months behind us, and comment after comment keeps coming through on the channel about how wonderful the process was. And so, Kobe, thank you so much for joining us here today on the channel. I know that for those of you who don't know, it's 8 o'clock New York time, and he's on the video with us instead of spending time with friends and family. So, Kobe,
No,
thank
it's
you
great to be here.
for joining us, and we'd love to have you back again sometime.
Thank you so much for having me. This is fun. I don't sleep that much, so any time of the day is fine with me.
Great. Kobe, thank you. Gang, thanks a lot for watching, and we will see you in that video right there.